Up next, it's Emily's turn to face the music as she unveils her Carver palaver. Emily's going to tell us why she reckons the NHS needs huge reform. Start the clock.
Yes, I think NHS pay rises, if they're given, must come with the promise of NHS reform. I think that's what patients deserve. I think that's definitely what the taxpayer deserves. And I also think that's what NHS staff themselves deserve. I think if we've learned one thing from the mass walkouts this week, beside the fact that NHS staff morale is at rock bottom, is that the NHS as a healthcare system is no longer fit for purpose. Of course, bumper pay rises would be great for NHS staff. Who doesn't want a big fat pay rise? But I think it would simply be a sticking plaster. We have a big problem with the NHS on a grand scale, and I'm not just talking about the number of people who work for the health service, which is over 1.3 million the last time I checked. I think that we need to stop being little Englanders, look out to the rest of the world and see what else is on offer. There is a reason that no one has copied our health service. Well, there you go. Who should I go with first? I'll go with you, Dominique. What do you think? Do you think pay rises, they're all well and good, sticking plaster, if we can just about afford a bit of a bump for nurses and doctors? It does seem like they deserve a bit of a pay rise. But I think the taxpayer deserves for it to come with some strings attached, perhaps, for the staff as well, that actually we get a commitment from government that the NHS will be reformed.
I mean, it just depends on what sort of commitment you're looking for from the staff. Because, look, I've heard both sides of the debate and, you know, the narrative on sort of the rightward side of the debate is that these are Marxists, these strikes are politically motivated, they're lazy, the NHS is a financial black hole. And, look, I sympathise with some of that. But then, at the same time, I think in this particular moment, our nurses and our doctors are, you know, some of the most important people in this country. And if they are coming out en masse and saying we are underpaid and we are overworked and we've been starved of the proper resources in order to do our jobs correctly, I think that should be listened to. But then again, yes, at the same time, the NHS is wasteful. I'm just not so sure that the responsibility should be put on the staff more so than the government.
No, I think it does have to be with the government. And, of course, NHS management need to work with the government if there is going to be any hope of any substantial reform. That's for sure. But I think we could go on ploughing, Benjamin, we could go on ploughing billions, millions, whatever, into the NHS, paying all of our GDP towards the National Health Service. And I do worry that fundamentally it is not fit for purpose. Dates back to the 50s. Things have changed. We need to look abroad and see what's working better.
I mean, you look at the US system, and that costs considerably more as a percentage of GDP than the British system does the National Health Service.
What about the Australian one, where all the doctors apparently are going, fleeing?
Well, I mean, do you know what? If you were to roll back the clock to when there was a Labour government, well, you had doctors and nurses and NHS staff paid much better, the retention much higher, and the quality of healthcare people
What level was
much
inflation
better.
at during the Labour government?
Well, why don't you blame Liz Truss for that? That'd be fine to see.
Because, blame Liz Truss for the global inflation crisis.
She sent the economy through the ground when she was in power for just 46
Blame Liz Truss
days.
for the global inflation crisis.
Albie, would Labour run the NHS better than the Conservatives?
Look, I think if you just look at the key core metrics for the NHS after the last Labour government versus where they are now, it's undeniable, as a Conservative, I will say, the NHS was in a better state in 2010 than it is in 2023. And it pains me to say that. But the economic situation of the country over the last 13 years is very different now than it was from 1997 to 2020. But on the point about reform, Emily, lots of people talk about reform. What does reform actually mean?
Well, take, for example, the Australian model. There's an irony, actually, that so many junior doctors who talk about how fantastic the NHS is are fleeing to a more marketised model. They have an insurance system, so everyone has Medicare, is what they call it. Everyone has that. And then you can top it up with private health insurance. And it means that there's competing services which raises the standard. For many people in this country now, they cannot get a GP appointment. And it's so difficult. They're waiting months, even years, for basic procedures. It really is it's outrageous, actually, how badly the NHS is letting us down. And that's not to say junior doctors and nurses are not doing their hard work. Seemingly, the conditions are appalling at the moment for them. But don't you think, Darren, it is time to step back? It's time for Rishi Sunak to pull his socks up, actually, and say, you know what, radical reform.
Well, I tell you what, Emily, it's not often that I point to the European Union and say there are some models there that we should copy, but there are. Systems around Europe have much better healthcare outcomes than we do here in Britain. And actually, they're often spending less than we are here in Britain. And you've got to ask yourself, fundamentally, why do you have a healthcare service? To me, you have a healthcare service to keep people alive. Something as fundamental as that. We're not very good at that in the NHS, and that isn't to criticise the hard-working staff who I don't doubt work damn hard, frankly. But when other countries, comparable countries, as I say, spending less per head, are getting better healthcare outcomes, and to stress that point, that means keeping people alive.
Say, there's a massive elephant in this room, and that's the demographics of this country, right? We have a rapidly increasing proportion of the population who are elderly. People live longer than before, and that is causing us to have... roll back the clock a few decades, and people would have far fewer ailments because they would die at maybe 70 years old. But now you have all these people, millions of people, who will get a number of moderately serious conditions because they will keep living until maybe they're 85, 90, 95 years old. And that is putting a strain on the NHS.
So what should we do about that?
We should have more immigrants. That was what you should have. That's why we need not only to train more people of our own
to
be doctors and nurses, but we also
They
need
get
to
old
bring
too,
we also need to bring more people in because our workforce age is too small and we have so many pensioners.
Why is the solution with you people always to artificially increase the size of the population with more immigrants?
No, but we need to sustain them.
Can I just say, Dominique,
that is an unsustainable way to run a country, and it's something that would rely on cohesion.
I said we need to sustain the level of the population, and the problem is that without immigration, because Brits aren't having enough children, the population would be declining,
well,
which would compound...
The population's grown by 10 million in the last 20 years.
Yes, because of immigration. If I can just finish my point. If the population was shrinking, it would compound all of the economic problems that we're seeing with the NHS at the moment. One of the fundamental problems with this country is that there aren't enough people to work in the health service, to pay enough taxes, to pay for this inflated bill that the NHS is
Well, I'm confused, actually, because the NHS employs, according to the ONS, 1.3 million people. I think there needs to be some rearranging, at the very least, of where those people are deployed.
Yeah, because I tell you what, our viewers at home, they can get hold of a diversity and inclusion manager in the NHS, but not a doctor, and that's a problem, isn't it? Right? People and viewers are screaming at
Do
the
you know
telly.
the number for a diversity and inclusion officer? It's not 999, is it?
You could go to a hospital and
So
there'll be one
how
there.
would you get in touch with an NHS
You walk
diversity
into
and
your
inclusion
local
officer?
hospital. You'll hear one, get one there.
Come on, Darren.
Right.